Good morning. This is Dr. Bill White again, and I want to show some cases here on expansion of adult dental arches with just arch wires. Now we use that large arch wire, but then you have to come in with a rectangular wire and put some buccal root torque in it so that you're expanding the roots as well as the crowns of the teeth. But you can expand people's mouths, uh, I guess, as long as they're living. I've got several cases here. This first one, I don't show the arch wires, I just show you the expansion of the case, and the lady is a, a year older than I am, and that's getting pretty bad. Except we did this back when she was a good bit younger, and I've got five of these cases that I want to just show you. So if you have been told that you cannot expand adults, maybe you'll believe that you can. I mean, you can expand. Uh, you don't have to separate the palate. You can just easily bring the roots out, and if you put the buccal root torque in them, you can just carry these roots out and just do it however you like to. I mean, you can just do all sorts of things with people, and I feel that there's just a world of this type of orthodontics out there, and the orthodontists that are properly trained and everything, that they would take hold of this and do these rather difficult cases because they're not all that difficult, but they have uh, root canal teeth, they have abscess teeth, they have periodontal problems and bridges. This I think this lady that we're going to do has a bridge in there, and we expanded the bridge just like a big two-legged tooth or something going out like that. So let's just get on to this, and it's just a short video. If you uh, don't have time to watch a long one, here is the lady, and a very nice lady, and I think maybe this is a picture after we did this. But here I'm gonna go through it pretty quick. This is her mouth before we expanded it. I mean, she's got a crossbite back in here on this side, and some crossbite area back in here, and this is a bridge. She redid the bridge after we got through, and the upper teeth are crowded and everything. And you bring all this out, and you can put the buccal root torque, bring the roots out. You don't have to separate the palate. It'll expand and go on out. The roof of the mouth may drop a little bit as they expand, or it just stretches the bone out. Uh, and the teeth hold up and good, and so I don't see any reason for not doing things. And these are people that have gotten older and they don't like the way their teeth look, and so they have the money to do it with, and so go ahead and do this on adults. And I think that there's just a world of this type of orthodontics out there to do, and I don't think there's enough orthodontists or dentists doing orthodontics to do the orthodontics that is available out there if we just did the things that they want to do. So anyway, well, let me go into this. Here's the case. It's got a crossbite on the right side of the mouth and a crossbite on the left side. She must have been a mouth breather, but the tongue down in the bottom part of the mouth, and it widened it out more than the upper arch in here. These are functional problems that people had years back, and you develop these arches. She doesn't genetically have a maxilla that's more narrow than the bottom arch. It developed after she was may have been a little girl. I don't know how long this has been in there, But anyway you see it, they don't like it and they want to fix it up, just go ahead. Now here is the upper arch. You can see it's more narrow than you would like for it to be. So we just expand this out. I didn't do all that much expansion on it, but we spread it out where we could get the teeth over the other teeth. And here is the lower arch, and it's more narrow. I mean, more expanded than the upper. And there's a bridge that we're going to, and we'll spread this out enough to line all this up in here, and it works, and it doesn't run the teeth out of the bone. They still have bone on them. I'll show you the X-rays when we get through with this case. I just didn't show you the arch wires with it, but I've got 4 other adult cases I'll show you. Here it is. This is 1999 here, and there the arches are on the models, and the cross bites on both sides. There's the narrow arch there, the wider lower arch, and we expand it even more and expand the upper arch to fit over it. It's a 7 of 99, and this is a bridge there, and here is the lady, and I think this is after we expanded it, and there she is wearing her retainer. That she'll have to wear a retainer. She may have to wear the retainer the rest of her life. I don't know how long, but we expand it and expand the roots and put a retainer in there that holds it, and she's happy with it. And this is '03, when we started it back in 99, and at that time, let's see, her date of birth was 1926, and I was born in 1928, so she's 2 years older than I am, or about that. And this is this is 2003 right here. And there is the arch when we started, and here it is after we finished it. Now that's not perfect. It's not uh, exactly like I would like it. I would like to touch it up a little bit more, but this is 2003, and she'll have to wear this retainer, I suspect, the rest of her life, or at least sleep in it, something like that, and she'll be happy to do that. Now let me show you that's the one side of the right side, the crossbite, and there it is after doing the work. We expanded that. We even expanded the lower arch, see, to line these teeth up, so we expanded this more. And this is a bridge. She redid the bridge after we got through and fixed it up quite nice. She didn't like the bridge she had, so she redid that. Uh, so here's somebody that has some money to spend on her mouth and she wants to fix it up. Then why don't we do that for people, those that want to do this, and can go ahead and do it. Now we look at the anterior part, and there it is after we finish. Now after she wears this a while, these teeth will erupt in here better than they are right now. This is right after we got through, I guess. Uh, and there's the upper arch when we started, and there it is, but it has a retainer in there. The retainer's not set real good. I don't think it's fitted up in the roof of the mouth proper there for that picture. And here is the lower arch, and there's the lower arch after we get through. So this lower arch is bigger, but not a great deal bigger, but it had to be larger down in here to get this in, and that worked fine. And you can see the way it is. And this is 2003, and she put a new bridge over here. Her dentist did, and I don't know whether her dentist referred her to me or not, but anyway, I got to see the lady, and we lined it up, and she's happy, and she looks so much better. And let me see, I'm going to go through and show you some x-rays on it. This is just the previous. All right, here is the uh, X Panorex of her X-ray of her teeth back in 1999, 6/23 of 99. Now at this time she's 72 and 11 months. She's nearly 73 years old. So you add from there up to today, was she's she's just a couple of years, or just about a couple of years older than I am. And we've got a bridge in here, and one of the teeth has a root canal on it. The bone structure's, not the best in the world, but let me go back and show you the original. Well, let's see. Oh, that's the original Panorex right there, and here's the Panorex in '03. Now, the bone structure looks pretty much the same on the teeth. This is not a perfect Panorex, and she's 78 and 7 months old at this time, and so you add that, and so she's about 92 or 3, somewhere there now. And I guess if you could find her, if she's still alive, I would almost bet you that she's still got her teeth. Here she is. This is the last picture of this video. And I don't mean to twist your leg to do this type of orthodontics, but there is a ton of this out there. Much of it is going untreated, and people have been taught that they cannot move the teeth. You can't expand an arch in an adult, and that is a mistake. And I'm going to show you 4 more cases similar to this. And if you want to do this, you find people that can do this, and we send these videos go all over the place. And I, I I hope I'm not leading you into anything that is wrong. I have not found any problem with expanding older people's mouths, and I did it with just this old big daddy arch wire, and then I put a rectangle arch on it and put some buccal root torque so that the roots of the teeth would go out with the crowns. And that's what, so I'm going to say goodbye for this time. I hope you subscribe to our channel. Love to have you, and hope that these videos will help you in whatever aspect of orthodontics you are. And I'm a general dentist, but I had to learn it on my own. I couldn't get into orthodontic school, so I just went and studied from other. I went to annual meetings and everything of Orthodontic Society, and I just it, have a knack for doing it. But I am not an official orthodontist, but I've been doing it for about, I've done orthodontics now nearly 60 years. So I hope you learn from this, and thank you for watching, and I'll hang up here.